Well, hospitals are a place where we'd like to think we can feel safe. We're being taken care of, and if anything goes wrong while we're there, we'll be looked after. But unfortunately, this sense of security could be at risk for well in excess of 20,000 Australians. Now, there's an ongoing legal battle between Medibank Private and the hospital group Calvary Healthcare over who should be responsible for the cover of accidents in hospitals, or as they call them, highly preventable adverse events. Now, Medibank believes that hospitals need to take greater responsibility. They don't think they should have to pay for their mistakes. But, of course, Calvary believes that Medibank has the duty of care. Now, the problem is Medibank has threatened to withdraw its cover at Calvary hospitals, which means the real losers in this situation will be the patients, and there's plenty of them. I'm joined on the line now by Christopher Zinn from the FiftyUp Club. FiftyUp Club, of course, one of our key advertisers on the station. It's a club that we've built up with in excess of 125,000 members, which is quite extraordinary. Chris, good afternoon to you.
Good afternoon, Chris. And about a quarter of those members are with Medibank, so they're naturally concerned about what's going on.
Aha, and that's probably how you found out about the problem, right?
Yeah, look, that was part of it. I mean, it has been in the news as well, and this might just seem like a spat between an insurer and the hospital providers, but actually we are the meat in the sandwich too, because there's an issue that actually maybe the care that we expect, it's not so much the care won't be there, but it's actually who pays for the care, and it's potentially exposing the members, you know, the consumer, to added out-of-pocket expenses, which can be bad enough already with private health insurance.
Give us an example of highly preventable adverse events.
Look, one which was explained to me, and this is Medibank's take on it, is if someone has had surgery and, say, a hip replacement, and they're put in a bed, but there aren't the various side panels put up to prevent you rolling out, and you fall out and then may have another break, who is responsible for that? Now, Medibank say the hospital should be responsible for what they term as preventable adverse effects, and there's about 165 of them. So they include falls and complications when an implement is left inside someone, infections after surgery, you know, where drugs or normal practice mean there shouldn't be any infections, and also the development of pressure sores when in fact turning patients and taking other interventions should reduce that. So it seems that a lot of it is an argument about what is preventable, what is adverse, and who should actually pay for it. Medibank basically say, look, we shouldn't pay for it because actually that is the members of the fund who pay for it. If the hospital, if the patient suffers from something as a result of the hospital not doing what it should do, then the hospital should pay.
So while this Barney goes on, you're only 6 weeks away from the contracts not applying, and then what happens after that?
Well, Medibank say that the issue there is that they will still pay the costs of you being treated in Calvary, but as those costs are not tied down by a contract, you could be exposed to additional out-of-pocket expenses. Now, one of the issues, if you go to a private hospital, you know, you can have all existing out-of-pocket expenses in terms of the doctor or the anaesthetist who can, you know, are free to charge what they like, or what the market will bear. This is in terms of the costs which the hospital might put onto you. So there's a pretty significant argument, because the word is that Medibank are on collision course with Ramsay Healthcare and Healthscope, and those are the two big ones in terms of private health. They have 70 and 44 private hospitals between them. So
some of these patients might have to go and sue if they want action.
Look, they will get treated. The issue is that they could be charged out-of-pocket expenses, which normally should be covered in the contractual agreements between Medibank and the private hospitals. But look, there's no doubt it adds a level of uncertainty and distress to those who believe that they're already paying enough for private health insurance, and there should be a minimum of extra charge and uncertainty. I hasten to add, it's not about the actual care that you will get, although Medibank claim that they're doing this not so much just to save money, but also to insist that there is a better quality of care in the hospitals, and the hospitals are more accountable for any mistakes they might make. And
in terms of Medibank policyholders, we're not talking about a few thousand. Calvary, I know, operates about 11 private hospitals, right?
Yeah, well, exactly. So there's a lot. I mean, there's something like 4 million people with Medibank. and there's something like 450 hospitals, private hospitals, with which they have agreements to date. So Medibank say, look, we'll keep our members informed, and if there needs to, there's 450 hospitals to choose from. Having said that, people who perhaps had treatment in one hospital, which is convenient, or they know a doctor who practices there, naturally may want to go back to that again. So hopefully that they can get this thing straightened out.
Yeah.
But there does seem to be a brinksmanship, and as I've said, we're concerned that the patient really is the meat in the sandwich in this.
Yeah, it's a real standoff. At the start of the program, question without notice, Mr. Zinn. At the start of the program, I spoke with our reporter Katie Kimberley, and she's covering the story where we've had 40 house fires in New South Wales in just 48 hours, and they're talking about people bringing outdoor heaters inside. They don't have smoke detectors, and the warnings coming out of the fire brigade are quite stern, because I don't think I've ever seen a period in winter where we've had 40 house fires in one state in 2 days.
Look, it does sound extraordinary, and look, the causes may well be that we've had a cold spell. I suppose the issue is, I would suggest with smoke alarms, there is a saturation, I would think, level of information around that and about swapping the batteries. In terms of some of these heaters, certainly they have labels in the packaging which they do not use indoors. They don't always have it on the actual product, but although I have seen that, but it really probably needs a big public education campaign. That would be at the heart of it.
And it sort of sums up exactly the problem, because with high electricity prices at the moment, and they still are high despite the fact we've been given a reprieve with the carbon tax, the prices of electricity are still high, and we're trying to make shortcuts to keep warm.
Look, exactly, and there's sort of people are conscious of cost of living pressures anyway, so even if the heat comes out of electricity prices, there are other costs eating away at their wallets, so they may well seek alternatives. And again, heating is something that you need to be very careful of. And ironically and unfortunately, the cheapest kind of heaters, i.e. the electric bar heater that you can buy for $15 in some shops, is the one that is the least efficient at heating your house and the most expensive. So there are rebates available for pensioners. There are things that some people can do to reduce their bills, but obviously they need to do more of it. And some of them, are plainly either dangerous or not very effective at reducing their bill. Yeah,
good stuff. Good on you, Chris. Thank you very much for that.
My pleasure, Chris. Bye.
Christopher Zinn from the 50Up Club, an advertiser on the station, but at the same time, you might want to go to their website, 50upclub.com.au, just to have a look at some of the offers that would probably supersede the contract you're on, or the agreement you're on and the rate you're on with your own electricity provider if you're having problems.